Thanks, Tim, but my time's up. You took it all. Mr. Mayor, thank you for your kind hospitality, Tim, and my colleagues here. You all are very fortunate to have three preeminent healthcare institutions and dedicated people who want to do these things to improve the health of our communities. Tim, thank you again for the introduction, but somehow when I get to those introductions, I always feel a lot like Ricky used to say to Lucy, you got a lot of splaining to do. That it doesn't engender a lot of confidence in your peers when they find out their Surgeon General is a high school dropout. So, but you probably think, well, he's just a federal appointee, it's not a big deal, you know. I understand. But my path to becoming Surgeon General really bespeaks more of how great the country is and all the opportunities that we are afforded. My family is very poor. I'm first born in this country, immigrant parents. We're homeless as children, and you know, so a lot of the knowledge I took to the office of Surgeon General to be the doctor of the nation really was based on experience as much as it was in any academic degrees I received later. And although it was quite a circuitous route to get there, I've worked a lot of different jobs. I've been a police officer, a paramedic, a registered nurse, a physician's assistant. A lot of people think that's pretty cool. Half the people think, well, it's just a guy who couldn't keep a job, and probably there's some truth in all of that. But really, every one of those experiences throughout my life actually greater sensitized me to the complexity of the healthcare system we have. And maybe right up front, I should say, it really isn't a healthcare system. We have a sick care system. You know, we perversely incentivize, we reward our providers to wait for you to get sick, and then they make a living based on making you better, but chances are you're going to repeat those same bad habits and come back. And so, you know, we desperately need this paradigm shift. But a lot of the experiences I had as a child really helped me understand, including the ties between socioeconomic status and health status in this nation, which are inextricable. The fact is, if you don't understand those complex relationships, you can't improve the health of an individual, a family, a community, or the nation, because they are so well tied together. And whether it's the United States or globally, these issues hold true. The greatest indicator of health status in our nation is socioeconomic status, and it's the same around the world as well. So as I moved in to become Surgeon General of the United States in 2002, and looking at what were the issues confronting us, of which there are many. Clearly, we're a nation of infinite needs and finite resources, and we have to be triage officers every day in everything we do. The fact was that we had to become a nation that started to embrace prevention. If for no other reason, we can't afford the path that we were on. The disease burden is mounting, the economic burden is mounting. We spend over $2 trillion a year on health care. That's over 16% of our gross domestic product. Of that $2 trillion plus dollars, 75 cents of every dollar is spent on a chronic disease. And chronic diseases are things you know every day. They're just diabetes, pulmonary diseases, cardiovascular diseases, stroke, hypertension, things like that. Yet, most people that grew up in my generation came to think of these things as an inevitable part of growing old. But the fact is, that's not true. We know that. You can defer. And we're all going to die of something, clear. I get that all the time at press conferences. But you can live longer with quality years if you address these issues of chronic disease. And right now, we're spending so much money on chronic diseases, and almost all of them are related to our own behaviors. The American public, though, doesn't fully understand how their behaviors equate to their ultimate health status and the burden that they place on society, economically and with a disease burden. As I look at my portfolio as Surgeon General, chronic diseases impacted everything I did. The top priorities I had as Surgeon General of the United States were first prevention. We look at examples, 9 million children who are overweight or obese, who start getting chronic diseases in childhood. These children who are overweight, who develop type 2 diabetes, develop hypertension in grammar school. We have middle-aged diseases that are ratcheted down now to grammar school. People smoke, and tobacco remains the #1 preventable cause of death in this nation and the world. And the fact is that My predecessor, Luther Terry, published the first Surgeon General's report in 1964 relating smoking to death. Almost a half a century later, I published the 27th and 28th Surgeon General's reports on smoking and health, the last one being the one on secondhand smoke about 2 years ago. Yet we still have almost 500,000 people a year dying of chronic disease associated with tobacco. And cigarettes remain the #1 product legally available that when used as directed will kill you, and we continue to sell them. But we tell the Surgeon General to keep America healthy. We subsidize tobacco crops. And when we look at the obesity epidemic, you have to remember that agricultural policy is public health policy. We drive some of the problems, our healthcare problems, because of unintended consequences of policy. It was my opinion, as I've told Congress many times, there should never be a policy passed in the United States that doesn't have some health expert looking at it for unintended consequences. Because we see that over and over again, that somebody goes, oh my gosh, why didn't we think of that? But then it's too late. It's 10, 15, 20 years down the line, and we're suffering the unintended consequences of those decisions, which looked pretty good at the time when you made them, but you're just not sure now. So I look at, that's the driver for prevention, a lot of it based on chronic diseases and eradicating chronic diseases. We're at a time when we have a healthcare crisis. We have 50 million or so people without health insurance. We have infinite health needs, finite resources. We have a sick care system. Yet, for those of you who are providers, if you said, I'm going to make a stand today. I am going to have a practice that just keeps people healthy. And I'm going to be, you can't make a living. There is no way to compensate you. We don't have a financial infrastructure to pay people to keep our populations, our individuals, our families healthy, which does seem odd, doesn't it? Where it's kind of like we're giving up and saying, okay, everybody gets sick and we'll pay people to make you better. Prevention had to be the cornerstone addressing chronic diseases. Now, interestingly enough, the two other areas that I spent a lot of time in as Surgeon General also had very significant ties with chronic disease. The second area was preparedness. People say, well, how could preparedness be involved with this? Well, often I didn't have that link. Early on, I must say, I'll preface my remarks by saying probably the greatest asset I had in going to Washington as Surgeon General of the United States was being very naive and thinking that I could change the world and stamp out disease and famine and pestilence, and wondered, what the heck did all those other Surgeon Generals do? How come there's so much disease? Why didn't somebody do something about this stuff? And then you get there and you see how complex it is, and having to practice science in a very political environment, both left and right. The things that seem everyday straightforward issues as far as science and health go sometimes become the most partisan issues where people are willing to stake their careers on. Yet you look at the pervasiveness of chronic disease. So in preparedness, we're at war, anthrax, terrorism, weapons of mass destruction, the tools of the terrorist. And I started thinking, because I couldn't get traction for chronic diseases, or I couldn't get traction for obesity, which is probably one of the greatest accelerators of chronic disease. Because if you're obese, not only does your cardiovascular disease, endocrinopathies, diabetes, and cancers increase all across the board, and many more complications. But I got smart as I was trying to spin this, because when I'm trying to compete with these big front page headlines, obesity doesn't even get on the sports page, okay? Yet we have 9 million children, overweight, obese, developing chronic diseases.